And now, of course, live with us on telephone call from Dhahira Governorate is Dr. Hind bint Khalfan Al-Ma'mariya, Director of Nursing in the Directorate of Health there. Dr. Hind, a very good evening to you, and also Eid Mubarak. Once again, congratulations to you and all nurses in Oman, and thank you for joining us. Now, can you hear me?
Yes, Dr. Abdullah, thank you very much for this opportunity, and good evening. And first of all, I would like to greet His Majesty Sultan Haytham bin Tariq, people of Oman and Muslims on the occasion of Eid al-Fitr.
Thank you very much. Now, the theme of this year's International Nurses Day is Nurses, a Voice to Lead, a Vision for Future Healthcare. Could you please highlight further on the theme?
Yeah. In regards, first of all, to the International Nurses Day, as you said in the report, we celebrate this date to highlight the important role that the nurses play within the healthcare system. And we celebrate to thank our nurses for their hard work and contribution. Earlier, we used to gather with nurses, exchange wishes, and conduct some recreational activities and recognize our nurses. Unfortunately, we cannot physically meet and celebrate as we usually do because nurses in the fields are busy tackling the novel coronavirus and trying their best level with other healthcare teams to provide good quality care. But we compromise it by sending them our wishes and thank you words and notes virtually. Like we have today a virtual meeting with the International Council of Nurses, and the president of the ICN congratulates all nurses and appreciate what they are doing in battling this pandemic. So, Mr. Abdullah, let me also take this opportunity to congratulate all nurses in the world and in Oman on this special day and thank them for their endless efforts, dedication, and sacrifice.
Now,
as you said, yeah, the theme is a voice to lead, a vision for future health care. As everybody knows that this is the second year, and our nurses in Oman, along with other healthcare professionals, are in the front lines, leading the healthcare system with persistence. So it is evident that nurses successfully leading the battle and the revolution against this COVID pandemic. And being in the front line, being very close to patients and society from the past many months until now is enough period to broaden their knowledge, the nurses' knowledge, expand their skills and perspectives. And I think by now, and because of the nurses' experience, they have a lot of thoughts in shaping the healthcare system and improving the quality of health services. So becoming a voice to lead means nurses all over the world, including Omani nurses, can talk to the governments, can talk to community leaders, can talk even to policymakers and investors and participate in sharing or shaping our healthcare model, formulating our public and health policies with other stakeholders, so we have a healthy policy, Mr. Abdullah.
Now, Dr. Hind, is the pandemic of COVID-19, we know that it has built a huge pressure to healthcare staff, including nurses. In your opinion, has the COVID-19 changed the scope of practice of nurses?
Yes, I think, Mr. Abdullah, the COVID-19 pandemic affected the nursing scope of a practice and caused expansion to the current scope. For example, nurses, I think, who used to work with confined or specific areas of practice were allowed to expand their role now to help during the crisis with the care of COVID patients. Like we have midwives who were moved to COVID floors to take care of intubated mothers with coronaviruses. We also have nurses from school health, from primary healthcare nurses, from primary healthcare institutions who were also posted to hospitals and work in general units.
Okay.
And and another expansion to the scope of practice that has been implemented in some parts of the world is the ability of nurses also to order and prescribe medication. And I think this was in response to an increased number of patients as well as deterioration of patients' condition. So I think, Mr. Abdullah, this is a transformational time for the field of nursing. And this global COVID pandemic has shed the light on the important role that nurses play in keeping our people in the community healthy and safe.
Now, Dr. Hind is a manager What your role as a health manager on this pandemic? Can you tell us?
Yes. As healthcare manager, we set plans with other stakeholders at the regional level on how to support our regional hospitals with human resources. And also, we keep updating those plans according to the situation. So we busily sit on a table discussing how to utilize the human resources and other resources in the governorate effectively during this pandemic. And also, as a healthcare manager, we make sure that our nurses are capable to deal with this pandemic, and they have essential knowledge and skills to deal with pandemic through proper training and refreshment courses. Also, we continuously listen to our nurses' concerns, and we support them and appreciate them with the available resources as much as we can.